On April 4th, the Business and Community Health Division will be meeting to share how our teams are impacting how we align lives to save lives. The purpose of this presentation is to provide you with a background of what the Bellin Health System and the Business and Community Health Division has established for the 2017 goals. By the end of this video, you should be able to 1. Understand what the system and business and community health goals are that need to be achieved this year. Number 2, understand how your department contributes to these goals. And 3, begin to establish in your thoughts how you individually contribute and impact these goals each day you are at Bellin. On April 4th, your team will be required to present your department goals and the work you are doing that is going to help drive meeting these goals. As we begin, let's define the departments within the Business and Community Health Division that impact our work. Number 1, sales and AEs, employer clinics, nursing, HRA clinic, sports medicine, occupational health, ergo rehab, fitness, telehealth, community activation, and number 11, population health. We know that many of you are remotely located, therefore making it difficult to see the strategy wall located in the Lywell building outside of Randy Van Stratton's office. This is a visual of the system goals to the left of the red line. To the right of the red line are the Business and Community Health Division goals, which were established by Randy Van Stratton and his team. The arrows create a line of continuity connecting the system goal to Randy's goals within our division. As we look at our overall theme for our system and for the evening of April 4th, we are continually striving to align lives to save lives, a phrase you will begin to hear frequently as this defines our mission. How we align lives to save lives is simple. We are seeing a shift in how we understand Bellin Health System goals moving into 2017. In the past, we have focused on bringing new employers on board and categorizing them by contract and type of services. We have measured our results using the relationship factor and set goals based on growing that relationship number. Our theory has been that getting people on the ladder drives downstream revenue. However, the data suggests getting people on the ladder is only part of the equation. This approach of aligning employers has focused on on-site clinics, health risk assessments, and occupational health with varying degrees of success, whereas on-site clinics have shown great success in increasing the aligned lives. The paradigm shift from aligned employers to aligned lives requires a similar shift in our strategies, tactics, and measures to achieve our new goals. It is no longer adequate to simply bring employer groups onto the ladder. While this is the initial step to engaging with the individuals, we now understand the true value is moving them up the ladder in meaningful ways that align lives with Bellin Health. As a result, Business and Community Health has to recalibrate how we view our mission and how it relates and impacts the broader system mission, vision, and goals. Moving lives up the ladder. How do we do this? Think of a completely aligned life to the Bellin Health System as a patient that has an established primary care relationship. They are receiving an annual physical. They're being managed for their chronic disease by their provider regularly. We are most engaged with this type of patient. These patients have climbed to the top of the ladder. We have many other patients with whom we encounter in different settings of our system for many different purposes. Bellin Health is now considering aligned lives as something that falls on a spectrum based on the level of Bellin's ability to influence an individual's healthcare, or from a patient's perspective, based upon the patient's engagement in managing their health and well-being. For example, as described, if a patient has a Bellin PCP and has had a visit in the last 18 months, they are weighted as a 1.0 in the aligned life metric. However, if the patient has only had an office visit but does not have a Bellin PCP, they are weighted on an engagement spectrum of 0.75. Visiting Bellin for a reference lab or an HRA only counts as a 0.1 in the aligned life measurement. In other words, not all engagement is created equal, and as we know, different types of engagement produce different results. Thus, we need to begin by defining the types of engagement that support our goal of increasing aligned lives and identify opportunities to foster increased engagement. This is moving lives up the ladder. Currently, Bellin has a system goal to have 265,000 aligned lives in 2017. As a reminder, this is a weighted number. This does not necessarily mean it is 265,000 unique lives. An example again is if we see a patient that has an employer contract to do only HRAs, such as the Green Bay Public School District. It would take 10 individuals to complete an HRA to equate moving this goal 1 unit. So as you can see, as of March 8th, we were at 257,386 aligned lives. Throughout our day, I now ask that you think about how you are working towards helping this goal. What do you do individually that helps align lives to the Bellin Health System? Looking at the system level, it is important to note that every goal established within the entire system, starting with George Kerwin's goals to service lines, departments, and individuals on your individual performance plans, are consistently aligned with the 4 objectives that are part of the Bellin Health mission and vision statement. These 4 objectives, of which every employee at Bellin should become intimately aware. The first objective is being a patient, family, and customer-driven organization. As we relate this system, mission, and vision to the Business and Community Health Division, we think of our team as providing solutions. Simply stated, our teams are continually providing solutions to meet our customer needs and requirements. The second objective that supports Bellin Health's mission and vision is team culture. We think of this as working together in our team. Working together both within our individual departments, but most importantly, working together across all of the departments within our Business and Community Health Division. By working together, we become more efficient and more effective by truly understanding our individual roles. We maximize our strengths across our teams and reduce costs by avoiding duplication of work or inefficiencies in work. Objective number 3 is population health improvement. The Business and Community Health Division is continually working innovatively to meet the demands and needs of our customers, the employers, and the patients to improve the health of every population with whom we encounter. And lastly, Objective 4 is growth and sustainability. Our system's ultimate goal is to continue to grow and sustain the organization so that our livelihoods continue to be positively impacted. For business and community health, we think of that as simply producing results. Now, this may sound simple, but this is not as simple as it sounds. Producing results requires an understanding of our populations, having a strategy, and working together, utilizing our strengths to achieve results. Our overall mission and vision for the system is to have the healthiest people in the region. If we break that down to our team, that means we want to have the healthiest people in our businesses and the communities with whom we work. This is an example of the system scorecard. Every service line and department should have a scorecard. A scorecard is defined as a report card. This tells a story of how your area is performing, very much like a report card a child brings home from school. It is important to keep in mind that these metrics are not the only metrics you will have. These are simply the high-level metrics used to evaluate your area and performance. These scorecards are also used on your individual development plans that are completed annually. Again, look at how the scorecard is designed. It is broken out by the 4 objectives. This is an example of the Business and Community Health Scorecard. The question now is, how do we achieve these goals? We know that our mission is to align lives to save lives. We have to be working together effectively and efficiently and align the work within the organization. We need to create synergy within the organization and our teams. This is where our roadmap and energy grid comes into play. More easily stated, this is simply a list of the work that has been defined that needs to be completed to meet the goals we've identified. Each department was asked to create the scorecard and the aligned work for the April 4th meeting. Within this grid, the following will be identified. Number 1, the initiative and the work that needs to be completed. Number 2, the departments that will need to be involved in completing the work. For each initiative, we want to be able to identify where our resource needs will be required within our team. This will help at the end of the day identify any resource constraints and will allow for us as a leadership team to review and potentially reestablish priorities. And lastly, number 3, this will identify the owner of this work. Each initiative should have a primary owner that will be accountable for the work, which means they will ensure the work is being driven to completion. The accountable owner will also be the individual to complete status reports. Where is the work at during a given time frame? And lastly, this owner will be accountable for understanding the metrics that align to this initiative, where to find them, and how to report them. This is a picture of our organization and how our teams align. As you can see, there are many relationships that we have with the rest of the system. It is important to take away from this that we are one large team working together, and we need to do this in an efficient way that improves teamwork and engagement, not only within our departments in business and community health, but also across the system. Take a second now to think about your work, the work you do every day when you come into Bellin. What are you doing already to align lives? And where might there be other opportunities to do more aligning of lives within your work? How can you help moving forward? First of all, go the extra mile. If individuals or patients or employers are asking you for information and you don't know the answer to it, find the appropriate resources that can help and get back to them and make sure that you close the loop with those individuals. Second, let's do that to help our patients climb the highest level on the ladder. We know that the higher on the ladder these patients are, the more engaged they are, and the more ability we have to influence them in their health and well-being. And lastly, this is going to align lives to save lives. So let's all work together and feel good about what we're doing every day that we come in to Bellin Health.